Welcome to this week's session. I am joined by David Byrd, who is our head of growth here at Infinx. This week, we're going to focus on creating a comprehensive financial verification plan, which is fairly new for a lot of providers, and definitely a new way of looking at the patient financial piece. I think typically a lot of folks are used to looking at that post-service, post-care, but we're starting to see definitely a shift in that. So welcome, David. Excited to have you here.
Thanks. Excited to be here.
All right. So what does a comprehensive patient financial verification solution look like?
So I think you just kind of touched on it, right? Healthcare, and we've heard this for probably the last 5 to 8 years, is moving into more of a consumerism type of market or services. And in my mind, that's where it starts, is with the patient and understanding the impact the financials can have on not only the patient, but also the facility's reputation. There was a study done by Conance that identified if a patient has a poor financial experience from the business office, that more than likely only 25% of those patients paid the bill in full. Whereas if the patient had a positive business office experience, then 75% of the bill was paid in full. So when you start to look at what your plan looks like, you have to start with the overall impact from a patient satisfaction and financial perspective. The verification plan is built from that starting point of when the patient first encounters the patient access representative and what the patient representative staff needs to interact with that patient to present the appropriate coverage for the test or the procedure, or whatever the patient is there for. For instance, did they verify that the patient has the insurance that they presented over the phone? Does the patient understand their copay or deductible? Will they need authorization for the test or the procedure, or what type of payment plan does your organization have for that patient, and do they understand that? So the verification plan should allow for a positive but yet thorough patient experience from the very first call or visit, so there's no hiccups for scheduling or when the patient walks through the door for the appropriate service. It's combining technology with the human component to ensure that downstream reimbursement for the services provided are collected. Clean data up front and understanding from the patient results in higher collection percentages for the back offices. And again, that's what the Conance survey identified. So it's a complete solution, but I would say that you'd have to start with the beginning touch point, and that's the patient.
A lot of really good points. Why is it important for providers to start putting a process in place for pre-service financial verification versus post?
Yeah. Again, I'm going to go back to patient satisfaction. I'm all about that. Patient satisfaction drives revenue, right? Delivery of care is outweighed once that invoice is received by the patient and they're looking at it and it's not at all what they anticipated. So, having a patient show up only to find out that a test or a procedure they have been scheduled for requires an authorization, or they still have a balance remaining on their deductible, it's absolutely vital that the patient access representative has quality data and access to that data in a timely manner so that the patient can have a positive experience from the first time they make contact all the way through the review of their invoice. Another statistic I'll give you from the Academy of Healthcare Revenue estimates providers have a 70% chance of collecting patient responsibility either prior to or at the point of visit or point of service, compared to 30% collection after the patient has been seen. So it's almost very similar to the other statistic I gave you, but very much identifies why it's important to communicate the cost, the understanding of deductibles, copays, what's due, isn't off needed for that patient, so they can assure that that collection happens upfront prior to or after the service has performed.
Brought up some really good points. I think the patient satisfaction piece is what this is about, right? I mean, and a lot of patients just aren't educated on like what their insurance covers and what it doesn't cover and what they're required to cover. I've often heard folks say that a lot of patients don't understand that their contract, right, with their insurance company requires them to pay a portion, right? And so I think there's just a lot of education that can be done there. And by educating patients up front, you increase your satisfaction, right, versus getting a bill. And that statistic that you just mentioned isn't a lot. I've seen that a lot, and it's true. I mean, 70% is a big percentage.
It's a big percentage, and think about it, in my own experience, walking into a doctor's office and, saying I'm here for the visit or whatever, and they say you don't owe anything at this time. And then 2 weeks, 3 weeks later, you get an invoice that has a balance due.
Right.
And it becomes very confusing.
Right.
And I've been in healthcare for over 20 years now, on
Right.
the back office side, on the RCM side. So, I can't imagine what most patients do when they see an explanation of benefits and it says this is not a bill, but yet there's all kinds of financials on that EOB. And it just goes over everyone's head, and then you do get an invoice. So yeah, it truly, healthcare is truly moving in. I don't think we're all the way there yet, but we're getting closer and closer to becoming that consumerism type of industry. And the last thing you want to have is upset patients, because they are understanding now that there's just not one imaging center, or there's just not one lab, or even for a hospital for that matter. There's not just one hospital I can go to, but there's multiple. And I'm going to check on Yelp. I'm going to check on Facebook. I'm going to check elsewhere to see what kind of services. And I think a lot of people, especially on the patient access side, forget that patient satisfaction isn't just coming from care, but it's all the way through the invoicing of those services.
Right.
So we're definitely moving in that direction, and with social media, things are changing.
It is. I don't know if you would agree, but I would also say it's really important, especially for providers that don't necessarily interact directly with the patient. And that kind of ties into a lot of the surprise bill conversations that we've had, but that's an easy way.
No, I totally agree with that.
What components are involved in terms of creating a really comprehensive solution that moves beyond just eligibility checks?
So I think critical components, and this may not be the answer that people are expecting that are viewing this or online right now, but in today's age and what we're seeing in the labor pool environment, staffing is absolutely a critical component to patient access. You have to marry that with technology, obviously, but the patient access representative needs to be able to address the patient's questions and understand how to use technology to ensure the right information is obtained and communicated. It's augmenting the expertise of that patient access staff with the technology that they're using. And I bring up staffing because these representatives, these patient access representatives are very, very smart when it comes to coverage. And if they're good, they'll know how to leverage technology to get the answers that they need. Anyone out there that has checked a procedure for eligibility can identify that, hey, yeah, this patient has coverage. We see the insurance card, we verified that. But getting down to the benefit level for that procedure or test to identify if an auth is required or not is absolutely critical. So, the example I gave before, having a patient walk in that's been scheduled 2 weeks out, and maybe they're in a rural community where they've had to drive 100 miles to get that MRI. And they present themselves at the front desk, and all of a sudden it's like, oh, we can't do the procedure because we haven't received authorization yet. Even if you're in a major metropolitan area, life is busy. You walk in for a scheduled appointment, your deductible's too high, or the deductible is higher than what you thought it was. Those things should be communicated prior to coming in for the visit or the encounter, and really having that staff that understands what's required, that has the knowledge, that can look maybe at technology and say, you know what, I think I need to dive a little bit deeper on this. So maybe I do need to pick up the phone and check to see if this test or procedure is covered by their benefit, and especially in today's market. So it's truly combining, human intelligence with the technology that the facilities are using. You just can't rely on the technology in and of itself.
It's a really good point. So I feel like we've covered this already, but anything you would like to add in terms of why providers should be verifying patients pre-care versus post-care, which is the way the industry's always done it, right? I mean, you bill insurance and then whatever's left, then you bill the patient and you likely don't see anything there. Anything you would add to that in terms of why there should be a shift in process?
Well, I think, that the tough thing about healthcare, and I think, it's in the past, you build after the fact, right? Is healthcare has kind of teeter-tottered on, we're taking care of a patient. We're not running a business.
That's such a good
but you
point.
are.
Right.
And it's a hard bridge to cross. But it's important in today's environment because of the high deductible health plans that are out there. Like you said before, patients don't always understand what's covered or not. So patients need to understand what they're responsible for and if they have the budget to pay for it. These are services that are being provided. There's a cost to those services. And so they need to understand what their insurance covers, what it doesn't cover. And this is where payment plans have started to pick up ground within healthcare, right? So if the patient understands that their deductible is higher than what they want, or the procedure isn't covered, or only a small proportion of that procedure is covered, then what's the payment plan that you have for that patient? I hate to say it, but I'm sure people have heard the saying before, bad data upfront leads to bad data downstream, right? And so bad data upstream in our world in healthcare leads to denials, write-offs, and bad debt. If you look at the top denial rates, typically across healthcare, they're typically for ineligibility, medical necessity, and prior authorization. And that all touches on patient access.
Right.
So in my mind, patients and facilities are kind of struggling to make ends meet, especially in the environment that we have today. And again, going back to the staff, having that proper knowledgeable staff and technology, it can truly streamline the process and ensure that reimbursement comes downstream. And again, I'll hit on it again. There's no surprises when that invoice shows up to that patient. They understand what the invoice amount is for and why it was billed. So yeah, we kind of did touch on that before, but to re-emphasize it, I guess.
Yeah. I mean, I've even heard folks, probably a generation removed from, but just with the assumption that don't pay it, insurance will pay it, right? I mean, I think there's a lot of misinformation out there in terms of what health insurance covers and doesn't. So that's an easier conversation to have before service versus after.
Exactly right.
So we talked a little bit about technology, eligibility, benefits, verifications. What are some other technology solutions that can help play a role in verifying a patient financially?
Well, I think the eligibility and benefits solutions have been out there for a while. Eligibility and coverage verification tech allows providers the ability to really gather the coverage information on the patients at or before the time of service. The solutions out there really can be used to perform batch eligibility for each day for the roster to validate, that the patients coming in are truly have the same insurance or have the same coverage. Even with patients like physical therapy or oncology, technology allows for reoccurring appointments to validate that the insurance is still up to date, that it's still the same insurance. And then there's always real-time insurance, right? So when that patient comes in, even though you've maybe run, the batch the day before, maybe you have a process set up in your facility where you're going to run insurance verification again to verify that that patient has the same insurance and or it's covering that procedure. So I think there's a lot of technologies out there. There's patient pay estimation, there's propensity to pay. But again, looking at, how your staff is interacting with those technologies, how they're leveraging those technologies to ensure that once that data gets passed into the billing system, that it's clean and you've lowered your risk for denial, write-offs, and or bad debt.
You brought up a really good point. I mean, the technology is great, but if your staff isn't trained, isn't leveraging it, then it's the same as not having it at all. So.
Right. It's no different than being educated on your insurance coverage, right?
Right.
The patient access staff needs to understand how to leverage their technology and how to communicate what data is coming back from that technology. And if they see something come back from a clearinghouse that doesn't seem right, then the smarter ones will know, hey, I'm going to pick up the phone and validate that this procedure or test is truly covered and we don't need an auth, because I know that I just saw a patient from Blue Cross Blue Shield that maybe was with the same employer, and you know what, we had to get an auth on that procedure. So it truly is combining technology and the human component that can help smooth the process. Right.
So it would be wary of technology solutions that say that they can completely replace, because they can't. We're not there yet. It's too complicated. Not yet, right? I mean, it's too complicated. There's too many exceptions. Anybody in healthcare understands that, but yeah, where you really start to see
even when you look at the payers and I've been on the claim processing side of the payer world, the dark side, so to speak, as the providers would say. But
Right.
those are huge, robust systems, and you can imagine what it takes for a human to read through a benefit book from an employer that's just negotiated, their rates for their employees and enter that data into the claims processing system. So like I said before, data is as good as the input. If you input it bad, then you're going to get bad results. And so
Right.
having the subject matter expert that truly understands what's going on in the environment is only going to help the tech that you're using.
Very, very true. All right. So you brought up staffing a little bit ago. If I'm a provider, I'm likely saying, this is great, but I'm short-staffed. What call to action would you give providers as a next step that feels like a realistic step that they can take, especially given all the staffing issues that everybody's facing?
Yeah, it's a good question. I think number one, you have to better understand your patient access process, from staffing requirements, scheduling, and what technologies that you have in place to access the appropriate patient information, right? I then take a look at your denial rates, your write-offs, your bad debt, and back engineer those components to how you're handling your front-end component for patient access. There's a lot of simple things that can be done to help with the downstream write-offs, bad debt, et cetera. So really understanding the process. Do you have the right people in place? Do you have the right technology in place? How is it being leveraged? Even looking at your scheduling backlog. Why do you have a scheduling backlog? Is it due to you can't get authorizations? Is it due to slow turnaround time for eligibility verification? What are some of those bottlenecks? I'm all into back engineering process. So if you really truly look at your write-offs, your denials, and the bad debt from a patient access perspective, and identify, okay, how can we address this? How can we impact this in a positive way, keeping in mind about the patient experience as well? So that's the call to action that I would suggest.
I think that's really important. Everybody's busy, right? So a lot of times, front end of the rev cycle, back end of the rev cycle, not a ton of communication going on there, but getting everybody kind of on the same page and understanding, like, what are our denial reasons, and what are our write-offs, what are our patient collections. It's really important to take a look at your process as a whole and get everybody on the same page in terms of what they're seeing.
Yeah, there's not a wall, or at least there shouldn't be a wall, between patient access and back office activities. I know that they're two separate departments, they're two separate functions, but they both have an impact on each other. And some of the larger organizations, you'll see finger pointing. Well, the reason the denials are so high is because they didn't check the eligibility correctly, and understand the frustration, but that's not the solution. So that's what I mean by kind of back engineering into the process. The upfront process impacts collections. So I would definitely take a look at the entire patient access process, from staffing to technologies and patient interaction.
Absolutely. Well, David, that's all the questions I've got for you. Any parting words?
Patient access is a critical component to healthcare, but again, we're moving into a customer service type of environment, and patient satisfaction, as we all know, is going to start impacting reimbursement. So it's a very, very critical component. I don't think most give it enough focus. but it's the first interaction that the patient has with the facility, and sometimes it's a reoccurring interaction that that patient has with the facility. So ensuring that they're getting scheduled and the tests are verified and the benefits are there, it's very, very important.
Absolutely. Good words to leave everyone with and remember. All right. Well, thanks everybody for joining. Thank you, David. This was a lot of really, really good information on definitely a topic that is on folks' minds right now. So thank you.
Absolutely. Happy to do it.